Hello everyone and welcome back to the channel. Today we're going to cover the details of cognitive testing, how it benefits your practice as well as your patient, and how to bill for it, how to get your office set up. Now let's get started. MCI, or mild cognitive impairment, can be hard to detect. Cognitive testing is often used to screen for mild cognitive impairment. People with MCI may or may not even notice changes in their memory and other mental functions. The changes many times are not severe enough to have a major effect on daily life or their usual activities, but MCI can be a risk factor for more serious impairment. Now, Medicare expects you to detect cognitive impairment during the annual wellness visit. So what exactly is impairment? Well, when you're talking about in the cognitive area, it's a significant difference in a person's mental functioning. That can be caused by things like anxiety, depression, memory problems, or disorientation. In fact, there's around 1,564 other ICD-10 codes that this is paid for by Medicare. And yes, Medicare does pay for this. They're not going to pay for it if it's being done verbally. But if you have the patient sit down in front of a computer and they take a psychological or neuropsychological test, then you do have a CPT code for it, 96138. It used to be code 96103. And the typical Medicare allowed amount in the country is $39. And yes, Medicare does cover the going over the results with the patient. And that can either be a 96132, it might even be an office visit.
Cognitive impairment. Cognitive impairment is when a person has trouble remembering, learning new things, concentrating, or making decisions that affect their daily life. Cognitive impairment ranges from mild to severe. How do you know if a patient has cognitive impairment? Your staff simply has the patient sit in front of the computer in your office. The patient takes a simple 15 to 20 minute online test, using the spacebar most of the time. When the patient leaves, the staff member prints the colorized report. She gives it to the doctor, and your doctor is able to detect whether the patient has cognitive impairment.
If you're only doing one of these a day, it's not a lot of money, but it's going to help you cover the expenses while you're helping your patient. About $3,000 a month or $36,000 a year. Now, the report that the medical provider gets is colorized, so that way it makes it easy to be able to spot whether or not it's minor, whether or not it's subjective, whether or not there's any kind of cognitive impairment at all, or whether or not we need to take the car keys away from the patient. As we get older, human beings are going to have a certain amount of cognitive impairment. And it's going to continue to decline as the older we get. And the problem is most family members, they have no idea where to turn to for help. How quickly the cognitive abilities are going to decline, what kind of a treatment they can do, etc. So they're looking to you, the medical provider, for help. For patients with cognitive impairment, even minor impairment, you really should schedule a cognitive assessment planning visit with the patient and their caregiver to go over the results. A future webinar is going to be covering how to do that as well as how to get paid for it. It's very, very profitable. Subscribe to the channel so you will be able to know when that new webinar comes out. We have helped hundreds of our clients in the last 10 years with cognitive testing. Click on the link in the description below to be able to request a demonstration and get 5 free tests because you're our clients. And don't forget, please click like and subscribe.